HealthCare Community Connection is sponsored by UK HealthCare.
At 8:26 on this Tuesday morning, we are joined by Dr. Pierluigi Porcu. He's here to discuss blood cancer treatments at UK Markey Cancer Center.
Thank you so much for being here. First off, let's start off with an explanation of what blood cancers are and what symptoms patients may experience.
Yeah, so when we're talking about blood cancer, we're talking about fundamentally three family of diseases: leukemia, lymphoma, and multiple myeloma. And these are not rare cancers. These are fairly common cancers. Every day, 3 people in the United States are diagnosed with either leukemia, lymphoma, or multiple myeloma. Altogether, they comprise about 10% of all the new cancers diagnoses in the U.S. and 190,000 new cases every year. In 2024, there were 190,000 cases of leukemia, lymphoma, and multiple myeloma. So the way lymphoma and myeloma and leukemia develop is through a block or a disruption of the normal maturation process of normal blood cells. So from this, 2 things follow. One is the abnormal cells build up in the body over time, and that shows up as, for example, too many white blood cells in the blood, in leukemia, or enlargement of the lymph nodes in lymphoma. The second thing that happens is that the normal cells are not actually produced effectively, and that leads to the symptoms that people with leukemia, lymphoma, and multiple myeloma have, which is weight loss, fatigue, night sweats, in the case of lymphoma, enlargement of the lymph nodes, and so on. And so these are the main symptoms that derive from the manifestation of the disease.
How does diet or a person's lifestyle play a role in their risk factor?
Yeah, so we all know that, a healthy diet is really sort of essential for kind of, longevity and normal health. And that plays an important role also in these blood cancers. Not necessarily as a direct cause of any of the 3 different types, but it makes things significantly worse. So, for example, particularly in terms of the consequences of, a bad diet or certain unhealthy lifestyle. So obesity, for example, is a very important part of making challenging the treatment, in terms of the dosing of the chemotherapy, the side effects of chemotherapy, and so on. And smoking is another important lifestyle factor that really contributes to making blood cancers in particular, more aggressive, more resistant to treatment. And so all these things really need to be addressed. Fortunately, at comprehensive cancer centers like Markey, there's a fantastic team of supportive staff, supportive care, oncologists and nurses that really help patients go through this.
What are some of the treatment options if you're diagnosed with one of those cancers? Yeah,
the treatment for blood cancers has really significantly improved over the past 15 to 20 years, particularly in the last 10, mostly thanks to research. Unlike some of the more common cancers that we are familiar with, like breast cancer, prostate cancer, colon cancer, blood cancers by definition are not limited to one particular organ or one particular part of the body. So surgery and radiation are not the dominant primary modality of treatment. And, historically, chemotherapy has been the primary modality of treatment. And that has produced good results, including cures in many patients. But it's associated with toxicity and is really not what we want to continue to do long term. And so over the past 10 years, there has been a lot of progress in developing new targeted therapies, often oral type of chemotherapy that helps patients producing cures, sometimes long-term controlling the disease.
Well, keep up the good work. Obviously so important to so many people, and it's great to have you here in Lexington, Doctor.
Thank you very much.
All right, there's some information on your screen about UK HealthCare.